All right. So I was just talking about the Affordable Care Act today, just less than an hour ago, with a friend of mine who needs healthcare insurance. Hard to believe we are 13 years into this. Where are we now and where are we going?
Well, as you said, it's been 13 years since one of the most consequential pieces of healthcare legislation in history was signed and transformed our access as Americans to affordable, quality healthcare across the country. Today, more than 40 million Americans have gained access to such affordable, high-quality healthcare thanks to the Affordable Care Act, and we all benefit from some of the provisions that did not exist before the Affordable Care Act came into being. Things we now take for granted, like the fact that insurance has to cover preventive healthcare services, can't deny coverage to people with pre-existing healthcare, the expansion of Medicaid. I think all of these things have been transformative in terms of ensuring so many millions of Americans and families across the country can have access to the crucial services that they need and stay in good health.
There are a lot of people, though, they've been to the marketplace, they've signed up for Obamacare, the Affordable Care Act, the Affordable Care Act, and they have tried to use these services. But a lot of people say there isn't easy access to some of these healthcare providers. What do you say to those people?
Well, look, we have dramatically expanded both access to healthcare and made it vastly more affordable for millions and millions of Americans. And what I would say is President Biden over the past 2 years has made even more progress in bringing down costs, ensuring that seniors on Medicare have capped out-of-pocket costs for prescription drugs. We've expanded Medicaid. And so the president is making gains on all of the progress we've made under the Affordable Care Act over the past 13 years. But that stands in stark contrast to what congressional Republicans are trying to do, which is actually raise costs on Americans for their health care. We've seen that virtually every Republican budget and fiscal plan over the last 13 years since the Affordable Care Act passed has actually tried to make cuts to the Affordable Care Act, has tried to cut Medicaid. And we've seen reporting that that's once again this year exactly what congressional Republicans are trying to do. So right now, the president today on this anniversary of the Affordable Care Act is making a clarion call, using the bully pulpit to speak to the country about what's at stake here. We can either continue the progress that we've made to bring affordable, quality healthcare to millions of Americans, or we risk all of that when congressional Republicans get there. Yeah, go ahead.
Is there a way to come up with something that's a little more bipartisan?
Well, look, the Affordable Care Act, we think that's something that everybody should be able to get on board with. For decades, however, congressional Republicans have stood in the way of things like ensuring that we can negotiate better prices for prescription drugs through Medicare. And so we think that the question is really with congressional Republicans. Why do you want to put the Affordable Care Act on the chopping block? Why do you want to cut Medicaid, which is providing crucial services to people across the country? Why do you want to raise costs, healthcare costs on people while giving away tax breaks to billionaires? We think that's a question that congressional Republicans should have to answer.
Well, we know that it was controversial 13 years ago at the very beginning. Still seems controversial today.
I don't think there's anything controversial about making sure that kids in need, people with disabilities, seniors have access to quality, low cost, affordable health care.
What I mean by that is it's still a battle between the Republicans and the Democrats.
And we think
at the cost of Americans.
Well, the costs have dramatically come down for Americans, even as we've been able to expand benefits. There are more people with healthcare today than ever before, thanks to the Affordable Care Act. The results speak for themselves, and I think we want to ask the question of MAGA Republicans in Congress. Why do you want to continue 13 years on from passage of the Affordable Care Act to cut these benefits, to roll back these benefits without putting forward an alternative plan? And so, I think that you'll hear the president make a strong case for continuing all the progress we've made to date on the Affordable Care Act and expanding coverage, bringing down costs. And we'll ask congressional Republicans to put forward their plans, to lay them out for the American people and explain why they want to continue making these cuts to the quality, affordable healthcare that people need.
Is there a chance that we lose Obamacare?
Well, certainly that's what congressional Republicans have signaled that they would like to do. We've seen countless efforts over the last 13 years to cut benefits under the Affordable Care Act and to gut it all together. This president is committed to protecting and defending the Affordable Care Act and making sure that all of the millions of Americans and families who need affordable access to healthcare continue to be able to access those critical services. And you've seen this president do things like cap the cost of insulin for seniors on Medicare, begin to take on big pharma and ensure that Medicare can negotiate costs on other prescription drugs so that we bring down out-of-pocket costs for our seniors on Medicare. And he's looking for, he wants to work with members of Congress to do things like cap the cost of insulin for everybody. We've made progress, enormous progress on that already. And you've seen some of these big companies, including Eli Lilly, see the writing on the wall and take action to cap the cost of insulin at $35. But we need to do more. And the president knows that. He's looking for those in Congress who should agree that Americans deserve affordable, low-cost, quality health care to work with him.
And healthcare that's easy to get. And what I mean by that is, if someone makes an appointment, it shouldn't be 5 months out. It shouldn't be 40 miles from their home. So hopefully these are the things that Congress will look at. Hopefully these are the things the president will look at.
Well, to your very point, right now, one of the things that the president has called out, if you go back and you look at the plans he rolled out, the budget he rolled out, he's pointed out that some of the cuts that Republicans in Congress are trying to make would actually have a devastating impact, could threaten to shutter rural hospitals where many of the patients and need to access services on Medicaid. And so I think as we look at exactly what you're saying, how to make sure that people are able to truly access quality, affordable health care. Some of what Republicans in Congress are trying to do is incredibly dangerous. And this president is going to continue to call attention to that.
Well, I think my hope and the hope among a lot of people is that the mudslinging will stop going back and forth and that more attention will be focused on the issues at hand. And that's taking care of all of us.
Certainly the president shares your goal, and we hope that congressional Republicans will work with us this year instead of trying to gut the Affordable Care Act and Medicaid once again.
Okay, one more question here. What is still to come? I'm not talking about the election. I'm not talking about where, congressional Republicans are and Democrats are. What is still to come with the Affordable Care Act?
Well, the president is today speaking about all that's been gained on the Affordable Care Act. But for example, he'll talk about how, under his leadership, we've not just, protected the Affordable Care Act, but we've actually helped make sure that we're raising the number of people who are enrolled in affordable health care in the marketplace. So today, under President Biden's leadership, we actually have more people enrolled. More than 40 million Americans have been able to access healthcare than ever. It's a historically high number of people. And so there are so many things that we can continue to do to make sure that we strengthen and protect Affordable Care Act as we go forward.
All right. Is there anything else you want to add?
No, I think we covered it. Thanks so much for having me.
Thank you for your time.
All right. Take care.
Yeah, we appreciate it.